This is Core Conversations with Natalie Baggio.
Welcome back to Core Conversations, and this week we are talking to the HouseCalls team. Thank you, team, for joining me this morning. And first, before we get started about HouseCalls and what we want to share with the community, I'd love for you to introduce yourselves.
Sure.
I'm Ron Siegel. I'm the medical director for our HouseCalls team. And for those of you who don't know, HouseCalls is a primary care service in the home. We have 4 full-time nurse practitioners, a part-time nurse practitioner, and a part-time physician, and me. And this is...
So my name is Maggie Lewis, and I am what they call the HouseCalls coordinator. So what I do is I do the intake for new admissions coming into HouseCalls.
Well, thank you both for being here this morning and willing to share about your services that you offer here within our community. And, you know, HouseCalls has been a real topic of conversation, especially as we start to see hospital at home and different types of care models that are becoming more transformational. But you guys have been here offering this type of service here in Southwest Michigan for how many years?
It's been
It's
4
over-
years.
I was going to say, well, I think it's been over 10 years.
Okay.
Originally, it was part of the Caring Circle.
Mm-hmm.
So I know it's been over 10 years since HouseCalls has been around.
So if someone was interested in HouseCalls, you kind of gave us a brief introduction. How would people contact you? How would they know that this is a service that they could learn about or maybe that they'd be interested in?
Sure. So people in our community that maybe have not heard about us, I usually like to tell them that we are a primary care group. We are part of that Corewell primary medical group. We're patient-centered, but we differ a little bit because our providers focus on caring for homebound patients in our community. I always suggest that if they do have a current provider, that to contact them, talk to them, see if our program is something that they would benefit from. And that current primary care provider can actually send a referral to our office. But our office doesn't even require a referral. So patients can actually reach out to us directly to our office, and we can start the process and enrolling them into our service.
So you mentioned homebound. Is that one of the requirements for your service, or is that just the general population that you've been serving over the last 10 years?
No, it's really a requirement that people
Okay.
have to have medical situations and conditions that make it burdensome or taxing to try to get out of the house and get to medical appointments.
Okay.
And such situations often lead to them not being able to get out, not getting their care, and then their medical conditions worsen.
Okay. Well, you mentioned the team that you have that you work with, APPs, advanced practice
Yes.
providers, and physicians. So when you have a patient, how do you decide who sees what patient?
It's based upon geographic areas. Our team members are assigned to certain geographic areas, and that's where they travel and where they see those patients.
Okay. So what would a day in the life of a patient be like if you were going to go see a patient, maybe a patient story that
Yes.
you could share with the community?
There's a patient who has had congestive heart failure and frequently was in and out of hospital every 2 or 3 months with heart failure exacerbations. Gets in, gets managed, goes back home, told to follow up with the doctor. Very difficult to get out to a visit. So this person would then run out of their medications and they would decompensate, and then they're in a heart failure exacerbation and they're back in the hospital again. And this one person that really comes to mind, this was a cycle for a long time. And then HouseCalls has gotten involved. And this person has been involved with us for about 3 years now, has not been back to the hospital in the time. This is somebody who really was having a difficult existence, lots of symptomatic issues, poor quality of life, and now that's really improved for this person. And these are the people that we like to go out and see and take care of. And most people find it very encouraging that we're able to get there in the house and help take care of them. And it's really a privilege to get to see people in their homes.
That's really an impressive statistic to keep someone in their home and out of the hospital for 3 years with someone with congestive heart failure. So your attention to detail, your availability, that plays a sounds like a large portion of the success of a patient story like that. So if a patient needs you, do you have are you guys available 24 hours a day to address the patient needs and concerns?
We do have people who are on call
Okay.
24 hours a day. They're 7 days a week. During the typical business hours, we have our providers who are out seeing their patients in the community. We do have somebody who is what's called provider of the day. So if somebody's having more acute and urgent issues, they can call in. We can do those video visits if we need to. Also, sometimes our providers of the day will go, all right, I'm just on my way. I'll go see you.
Okay.
So we are trying to meet them wherever they are and take care of their needs in their homes.
So you do routine visits, and then you also do like emergency calls or acute care calls is probably what you would classify them as, when someone needs something today, where you can be able to respond by seeing them, video visit, or knowing them and helping them manage their conditions and symptoms.
Yeah. And during the typical business hours, we have our triage nurses. They will take the phone calls. They'll see if there's things that they can manage or set them up with a provider, whatever we can do to try to take care of those patients' needs.
Well, I'm really proud that we have this service in our community and able to help those who are not able to leave their home but still have access to care here locally. Is there anything else that either one of you would want to share with the community, or something that would be valuable for people to know about the service?
Yeah. I think with house calls too, people automatically think older seniors or geriatric patients. And we see a variety of ages. So anyone that has that, any chronic conditions that are keeping them home. So we pretty much see people that are in their teens all the way up to geriatric ages. It doesn't have to be a geriatric patient.
Okay.
Just imagine anybody with chronic medical conditions that make it really a challenge for them to get out to their medical appointments. We will take care of them. In their personal residence. We do take care of people in assisted living facilities.
Okay.
But those people who need those services and can't get out.
Yeah.
It'd be great if you'd both share why you love what you do so much with our community.
My favorite part, and I've told Dr. Siegel this before, my favorite part is actually doing the home visits.
Okay.
I love going into the homes, meeting the patients. Usually there's family there. And it's my job to make them feel comfortable and make them understand what we are about and what we will do for them. My favorite story is going into a home. The patient was a German immigrant. She sat there and couldn't say much, but by the end of it, she walked away from the table. When she came back, she handed me this Afghan that she had made, and she gave it to me as a gift.
Oh, that's so
That made me
kind.
teary-eyed because no one had done that before.
Mm.
But to me, I know that I made her feel comfortable and that we were going to take care of her. That's my favorite part of the day.
Yeah,
hmm
that's hard to top.
Yeah, it is. It is.
And for you, Dr. Siegel?
Yes, again, very similar that we get the privilege of being invited into their homes.
Mhm.
And it's still a professional relationship, but it's not as formal. And we get to know them and see
Yeah.
what their living situations are like and the caregiving situations. And people really appreciate that. We get to come to them.
Mm-hmm. That's great.
Mhm.
I can imagine that it's really opens up a lot of doors and conversations to have an ability to be able to reach beyond the immediate diagnosis too.
Yes.
When you're in someone's environment, it's not just that emotional, but you can also assess the physical space that
Yes.
could lead to a future challenge or hazard for the patients as well, and be able to help mitigate that earlier.
Yeah, absolutely.
Yeah.
Yes, exactly.
Well, it's such a wonderful service, and it was a privilege having both of you on this episode today and being able to share more information about House Calls with Southwest Michigan.
Yeah, thank you.
Thank you.
Thank you for joining us on this episode of Core Conversations.